Without further ado, I'm going to introduce, probably doesn't need any introduction, but Chautauqua County Executive, Vince Horrigan.
Thank you, Melanie. It's great to see this room filled again. I'm reminded 3 years ago, a little over 3 years ago, when we had our first drug forum, when it was so obvious that our county was plagued by this incredible epidemic. And we now see across the state, across the nation, everyone grappling with this very, very difficult program, or problem, I should say. We, last Saturday in Jamestown, we kicked off this Drug Awareness Prevention Week with a Rockin' for Recovery in honor of Alex Falk and the Mental Health Association, CASIC, WCA, UPMC, Chautauqua, WCA, and all the other providers that are working in this area. I have to admit that for a county executive to try to get his arms around this takes an entire effort. Our health commissioner is here. Pat Brakeman, our director of mental hygiene, is here. We have legislators here. I see George Barillo. Are there other legislators that are here? I always hate singling anybody out because I love them all. They're all important to me. But this problem and this effort, together at the local level, together at the federal level, with Congressman Reed, who's been here and held forums and is working to help in the support of programs and funding for this problem, to our state senator and assemblymen who have worked so hard in legislation and insurance. We are making effort, we are making inroads. But if you say to me, are we absolutely getting our arms around this, I have no idea. And quite frankly, I think we just continue to work at it every day. Last Saturday, Mark Polenkars was here from Erie County talking about how he's dealing with it. If you saw on the news, what have we had? I think 8 deaths over the last weekend or a few days with fentanyl laced or whatever the tainted opiate is. It's just heartbreaking and tragic. Yesterday we were in Dunkirk. The commissioner of Oasis was here. We were able to talk to her about our needs. But the other side of the problem is the work we're doing. I don't know if I want to call it good news. I'm going to call it progress. So I wanted to highlight just a couple things over the last several years that have been underway. The county has stepped up significantly, increasing our staff and our clinics. In the last 3 years, our clinics have increased their services to clients by 23% in Dunkirk and 17% in Jamestown. We've added staff as well to make sure we have open access every day. There is no waiting list. You can get in every day at our outpatient clinics. Oasis certified programs at the county, WCA, and the TLC up in Dunkirk have implemented an open access model. Anyone in need of treatment can come in that day and be served. We provide the treatment at the time that the client is ready. That's very important. Chautauqua Center, thank you, it's very important. Chautauqua Center has added Medicaid-assisted treatment to their services. Chautauqua Center, both Jamestown and Dunkirk. The Resource Center offers Suboxone in its PROS program. That's good. We need to applaud. That's good stuff. WCA implemented and then expanded inpatient and outpatient detox services, which had been an unmet need in our community. So thank you, Andy, for all the work that's been done. In our jail, so incremental to this problem is the incarceration and the folks in the jail. We've added certified addiction counselors to the jail. We've added care coordinators, which links all inmates with a history of addiction to treatment services upon release. We have a Vivitrol program, and again, another Medicaid-assisted program in the jail, so that inmates on release can be administered this long-acting injection to reduce the likelihood of relapse or death upon release. We've implemented CRAFT, Community Reinforcement and Family Treatment, at multiple sites within our community. This program, again, evidence-based, assists families of loved ones struggling with addiction to be effective support groups. The county's first residential program has finally been funded by OASIS and will open in early 2018. That is huge, residential program. We know we've needed that for a long time, and I have to acknowledge the work of Pat Brinkman, of our entire mental hygiene team, of Andy O'Brien at WCA, that have been relentless in requiring that we get this program, and it's finally come our way. Our annual addiction forum, I think this is the third one that I've attended, is here to have an open conversation. We want to hear the good, the bad, the ugly, but we got to have hope, and we've got to also celebrate the progress that we are making. The county and other providers have been successful in recruiting physicians with specialty certification in addiction medicine. And Dr. Ney has been very influential. Thank you, Lillian, for all your work in this effort as well, Dr. Lillian. In Narcan, the medication that can reverse the opiate overdose, we have heard about this so much, administered hundreds of times in Chautauqua County. And I also want to acknowledge Jim Quattrone. Where are you? Jim, you're here back there somewhere. Jim, not only as a responder in law enforcement, but has administered it numerous times, as well as faith-based leader in our community. So we are working on this. We're working hard. It continues to be a major problem, but you know what? We're all aware, we're open about it. We understand the disease part of it. We understand the law enforcement part of it. We understand the judicial, the medication. It's got so many components. So what I will tell you is that from Chautauqua County and our local elected leaders, from our treatment providers, we're all in. We're on this. We're going to work hard, and every day we can. We tend to be a smaller community in terms of numbers, that we don't get what maybe Albany gets or Buffalo, but we don't care about that. We're working every day to provide help, hope, and healing. Recovery is possible, and I want to thank you all for coming today and have a great forum here this morning as we continue on. So thank you very much.